Regarding hemiarthroplasty, Thompson arthroplasty is optimal, has narrow medial border, has increased load to cement. Austin Moore, fenestrated stem for bone graft impaction. Warwick hip trauma evaluation study. The Warwick study showed that Thompson arthroplasty for displaced neck of femur fractures showed no difference in outcome when compared to Exeter hemiarthroplasty in more than 60 years of age. Furlong is a bipolar and monopolar options polished taper colorless stainless steel. When you compare the bipolar with monopolar hemiarthroplasty, the results at 2 years is no difference in complication rate. Regarding cemented versus uncemented hemiarthroplasty, Parker et al. 2010, cemented hemiarthroplasty resulted in less pain, better mobility than uncemented. Tendency to have more periprosthetic fracture in uncemented group, more perioperative death in cemented groups. NICE guideline states that offer a THR for patients who are or displaced intracapsular fractures who, number one, able to walk independently outdoors with no more than use of a stick. Number two, not cognitively impaired. Number three, medically fit for anesthesia and the procedure. The only risk which is there after the total hip replacement is a dislocation risk. Regarding mortality, in elderly, every fifth die in the first year and the fourth need more care. Albumin less than 30 milliliter indicates poor nutritional status. Delay in operation beyond 48 hours increases mortality. The problem is AVN. NICE guideline states chemical prophylaxis and mechanical prophylaxis to 5 to 6 weeks.